and the man at the centre of the rollout of the vaccine, the Minister for COVID vaccine deployment, Nadhim Zahawi, joins us once again on the programme. Minister, great to see you as always, and of course plenty to discuss around the vaccine rollout, but I wonder if we might start with that which has been pretty widely trailed, that we are about to see some additional controls at our borders. Are we about to see the introduction of quarantine hotels?
Well, we'll review our border policy like any other responsible country would. Germany, Canada have done a similar thing in January. We've done that with the pre-departure testing that is now required to enter the UK, and of course with passenger locator forms. There will be an announcement on this issue later on today. So I can only say to you that it's the right thing to do, because I'm the vaccine minister, that as we vaccinate more of the adult population, if there are new variants like the South African variant or the Brazilian variant, we need to be very careful. We acted on those very quickly and, of course, dealt with travel from those countries and from Portugal and elsewhere rapidly. So it's important that we continue to review our border policy, and an announcement will be made when a decision is taken. And, of course, the industry itself, as I've just seen in your report, will be engaged with heavily, including Matt Hancock engaging with the industry to explain the decision-making at health, as well as, of course, the business department with the business secretary.
Some might challenge the contention that we are dealt with this particular situation quickly. We knew about the Kent variant, middle of December. We are now at the tail end of January. We look at countries around the world that have managed to contain COVID infections, Australia, New Zealand. I mean, those two countries that I just mentioned introduced quarantine hotels, not this year, not the tail end of last year, but in March of 2020. Aren't we once again just a bit too late to this?
Well, the moment the Prime Minister was informed about the new variant, if you recall, Neil, which I'm sure you do because you've been tracking this very carefully on Sky, was on the 18th of December. On the 19th of December, we entered into the fourth strictest category, and then very quickly moved on to the national lockdown. Of course, countries have to review their borders. Germany and Canada, I just mentioned to you, both did that in January. We also tightened up with the pre-departure testing and, of course, passenger locator forms. And it's right that we now have a vaccination program, which yesterday reached 6.5 million people with the first dose. As we vaccinate more people, it becomes more and more important that we protect against any new variants coming in. As the CMO, the Chief Medical Officer, the Deputy Chief Medical Officer have explained, once you have that protection and you don't have new variants in the country, you should protect against them. It's when they are spreading that it becomes negligible in terms of difference, in terms of what you do at the border, once they're already on your shores and spreading heavily.
But your advice to people kind of currently thinking about what they might be doing this summer would presumably be, don't be booking any holidays right now.
Absolutely. At the moment, look, we've reached base camp, if I can describe it as that, with the vaccine deployment program. Over 6.5 million people now with the first dose. A long way to go. We've had a tremendous performance. The NHS family, our armed forces, of course, the private sector, and the brilliant volunteers have come together to deliver this deployment. I think it's far too early. There's still 37,000 people in hospital with COVID at the moment. It's far too early for us to begin to speculate about the summer.
Let's talk vaccine supply for a second, in particular that row that appears to be brewing with the European Union and AstraZeneca. I mean, has the European Union threatened to block the movement of vaccines produced on the continent to the United Kingdom?
I spoke to AstraZeneca's Chief Executive, Pascal Soriot, last night, and I'm confident that AstraZeneca and Pfizer, and I have to commend Pfizer as well, and Albert Bourla, for both these are great global companies that have promised the whole world that they will produce billions of doses of vaccine, because no one is safe until we are all safe. I'm confident that they will both deliver for us the quantities that we need to meet our mid-February target, and of course, beyond that.
But has the European Union threatened to block? I mean, obviously, the AstraZeneca production is in the main in the United Kingdom. It's the Pfizer supply. And we've seen some pretty positive data around Pfizer, of course, which I'm sure you've seen as well. So has there been an explicit threat that the Pfizer vaccine might be held up at the European Union border rather than coming here?
No, I'm confident that the Pfizer vaccine will be delivered. Pfizer have made sure they've always delivered for us. They will continue to do so. They have made very important announcements on the equitable supply to the whole world, including the European Union. And I'm sure they will deliver for the European Union and for the United Kingdom and for the rest of the world. This is a great company, a great corporate citizen, as is AstraZeneca, as is Moderna, and of course, other vaccines that are coming online. We have got 367 million vaccines that we have ordered from 7 different suppliers. So I'm confident we will meet our target and continue to vaccinate the whole of the adult population by the autumn.
Is all this perhaps a bit of sour grapes in the European Union, perhaps around the basis that we simply signed a better deal?
Well, I think, look, the European Union has to make decisions the way it has to make decisions. We will always support them. They are our neighbours, our friends, our allies, our trading partners. I think it would be very unwise for me to engage in their negotiations or their deliberations on their vaccine policy. I think it's much wiser for me just to focus on delivering for the United Kingdom and, of course, then for the whole world. We are the biggest contributors to the global effort, £1.3 billion going into COVAX, which 450 million to COVAX and the balance into CEPI and Gavi to deliver vaccines to the poorest countries in the world. Because, look, you said it earlier, we're talking about border policy here. No one is safe until the whole world is safe from this, which is why we need to work together rather than, as the head of WHO has said, rather than vaccine nationalism. We should really begin to work together now to deliver for the whole world.
Can we just have a very quick question on schools? And I suspect the ministers are becoming slightly frustrated with the number of times that they are being asked. There's a story in the Times today, which you know, an open letter, 10 of the UK's top experts in child health saying that anxiety, self-harm, suicidal thoughts are at frightening levels. Now, I'm not asking you to put a date on when our children will be back in schools. When will we know whether or not they're going to be going in after, whether or not they'll be going in after the February half-term?
So as the Prime Minister said, as we look at data all the time, there's been some encouraging data from Public Health England on primary schools and the infection rates amongst primary school children much lower, 5 times higher in secondary schools. We will review all this data.
But specifically, when will we know if our children will be going back into schools en masse after the February half-term? Really straightforward.
Well, once we see infection rates drop, as Public Health England has said, to levels that are safe and acceptable, then we will give notice, first of all, to schools, and then on your programme as well. We want to give notice, as much notice to teachers and schools.
So the default position is the schools are not reopening right now. There is no suggestion from your position, it would appear, that the schools are going to be opening after the February half-term.
Well, first of all, it's worth just making sure your viewers understand. Teachers, schools are open for the children,
of course,
frontline and the most vulnerable children. So they're doing an amazing job, and I want to thank them for that. Of course, to reopen completely, which is what we want to do, the Prime Minister's priority is to get schools open as quickly as possible. We've got to look at both the infection rates nationally. 37,000 people are in hospital today suffering with COVID. And of course, look at how we do that in primary, which looks like Public Health England see that infection rates are much lower than in secondary schools. And then of course, in secondary schools, it will happen. It will happen as a priority. I can't give you a timeline because it's wrong for me to speculate, but all I can say to you, it is an absolute priority ahead of everything else to get schools back open. And I commend Robert Halfon, Chairman of the Education Select Committee, for making sure that he is championing the cause of schools and education, because it is the most important thing. You know, I have an 8-year-old, and I can tell you it's hard to do online schooling. We're doing it.
I completely understand. We have such a finite amount of time here, Minister. I do want to push on to another topic, and this may well be one that you may well need to go off and come back to us on. My colleague Joe Pike has been looking at a quite alarming situation in a number of hospitals. We do not yet know if this is the case across hospitals in England, but it appears that many of them have a policy not to vaccinate inpatients, people who have gone into hospital with other conditions. I'll give you a couple of examples. We had Jan. She has been talking to us about her 99-year-old mother. Now, she's in hospital at the moment after an infection on her leg, not COVID-related. She was told repeatedly by staff that it's not their policy to vaccinate inpatients, Yesterday, Jan got a call from the hospital to tell her that her 99-year-old mother has picked up COVID in hospital. Janet's mum, 86, fell over, broke her hip in 3 places. She's in hospital. Staff there say they're not vaccinating inpatients. So we have people potentially in those top 4 cohorts that we are trying to target who are in a hospital environment, which we know is potentially quite dangerous, who are not being given the vaccine. Why is that the case?
Neil, so there is no policy to say that hospitals shouldn't vaccinate those who are eligible in those 4 cohorts, and both of your examples are eligible. So there is no NHS policy on that issue. Of course, they are vaccinating outpatients because that is what they wanted to do early on. But it's only right that they make sure those in those cohorts are also vaccinated. I'll very happily look at those cases.
I'll say it again. The 99-year-old mother of Jan in hospital for an infection on her leg, repeatedly told that she couldn't get the vaccine, contracts COVID in a clinical environment. And then we have one of your colleagues in the Conservative Party, whose name escapes me for the moment, did a day of vaccinating in a hospital and picked up a dose.
As I said to you, there is no policy from NHS England to exclude people who are eligible, who are in hospital, from getting the vaccine. I will happily look at the case that you mentioned. Everyone who's eligible will be offered the vaccine by mid-February. That is our promise. That is what we will deliver. That is my absolute commitment to your viewers. Of course, if someone's caught the infection, 28 days after that, they will be eligible for a vaccine. As we have done with the residents of care homes, we will vaccinate all residents of care homes that are able to be vaccinated, i.e. the ones that aren't currently with COVID, by the end of this month, and the staff in care homes as well. So our absolute commitment is those top 4 categories, the most vulnerable. We're already at, I think, over 70% of over 80s already with the first dose of the vaccine, and we'll get protection from that within a couple of weeks, 2-3 weeks, and of course the other 3 cohorts as well. But very happy to look at the case that your reporter has brought up and come back to you. But there is no NHS central policy to prohibit hospitals from vaccinating those who are eligible, who are in hospital.